Very happy to see all of you here on this Saturday morning. Before we get started, it's my job really to introduce you first to the Cancer Research Institute. So we've been around since 1953, and we've always had a singular mission that has always been dedicated to research on the immune system and how it interacts with cancer, with the ultimate goal of developing effective treatments for all cancers that use your immune system. So we're a public charity that has always relied on the generosity of individuals, foundations, and corporations to support our work. We are not endowed. We raise our operating budget each year, and all from philanthropic sources, and we receive no government funding. Now, we're very proud of our pedigree. We're always being very, very conscious of using donor contributions for our programs and for research. And I've been there for 30 years, and every year that I've been there, we've always spent less than 15% of our annual operating budget on fundraising and administration. And because of our transparency, efficiency, and effectiveness, we always garner the highest marks from all those charity watchdog organizations. Now, while much of the 60-plus years that CRI has been around, we have been dedicated originally to very basic research. And it's really gratifying to see that the discoveries we supported have now provided the foundations for today's effective cancer immunotherapies. In the past 6 years, 15 FDA approvals for immunotherapies in various types of cancer. That's an amazing amount of approvals in a very short time. And we now have the proof of principle that your immune system can be mobilized as a treatment for cancer. But more research is needed in order to maximize the effectiveness of immunotherapies for more cancer patients. And this will require a commitment to both laboratory and clinical research and crosstalk between the two. So we are now at a place and time that we've never been before in this field of cancer immunotherapy. We now have a significant number of patients who are responding remarkably well and in a durable fashion to immunotherapies. Unfortunately, there's also a significant number of patients who are not responding. This, however, gives researchers an amazing opportunity to now interrogate the precious tissue and blood samples from these patients and ask why the responders responded and why the non-responders did not. This understanding at a cellular and a molecular level will be what propels the field forward, as more focus is placed on personalized combination therapies and how to determine which patient should get which therapy. When we look back at the history of the field of cancer immunotherapy and at the history of Cancer Research Institute, it all started with patients. In the 1890s, Dr. William B. Coley, who was a surgeon here in New York, noticed that occasionally some cancer patients went into a spontaneous remission after they had contracted an acute bacterial infection. He went on to create a mixture of bacteria called Coley's toxins, which he injected into inoperable sarcoma patients. In fact, his first patient, Mr. Zola, underwent a complete remission. Now, although Coley did not understand the underlying mechanisms of how this toxin worked, his daughter, who after his death believed the medical community had abandoned the Coley's toxins prematurely as a cancer therapy, founded the Cancer Research Institute. CRI initially focused on Coley's toxins and the link between bacteria and cancer remissions, and in so doing, actually spawned the field of cancer immunology and immunotherapy. We now know that the bacteria in Coley's toxins attracted the immune system to the tumor site into which it was injected, and Coley is now known as the father of cancer immunotherapy. In 2016, we have a much better understanding of how the immune system works, how it interacts with cancer, and how cancers have suppressive mechanisms to turn off the immune system and evade immunological destruction. We now have new and exciting technologies, and we are learning how to overcome this suppression and also to enhance the immune cell activity against cancer. And patients, again, are critical to the research process. To reach CRI's mission to save more lives by fueling the discovery and development of powerful immunotherapies for all types of cancer, we will need to rely on the patient and the laboratory, and also that brain trust of scientists and clinicians around the world whom the Cancer Research Institute supports. In the past few years, as more and more patients are being treated with cancer immunotherapies, CRI saw a need to become more patient-facing. With our pedigree and expertise, we could become a trusted source of information about cancer immunotherapies for newly diagnosed patients and their caregivers and for those undergoing treatment. We launched a patient portal called the answertocancer.org and began to create an immunocommunity among patients. Today's meeting is an extension of those efforts. The theme of today's summit is empowerment and self-advocacy. I truly believe that the information and knowledge imparted today will go a very long way to give you the confidence to explore with your physicians whether immunotherapies are an option for you and your treatment plan. You will hear from patients who have been treated with immunotherapies in clinical trials. We will provide you with what you need to know about immunotherapies from the experts in the field. We'll try to demystify clinical trials, give you pointers on how to read scientific abstracts, and also give you tips on self-advocacy and advocacy for your loved ones. I think it's going to be a very special day, and I'm thrilled that the Cancer Research Institute can bring this to you. I would also be remiss if I did not thank our sponsors for generously underwriting this event so that we did not need to divert those precious philanthropic dollars from our research efforts. And so thank you to our presenting sponsor, Bristol-Myers Squibb, and to our other sponsors, Merck, GlaxoSmithKline, Genentech, and Regeneron. So now, before we get started, just a few housekeeping tips. If you're interested in getting matched to a cancer immunotherapy trial, we have patient navigators on site. So if you'd like to make an appointment, please see Frederick. Frederick, where are you? Are you here in the back of the room? Well, he's outside by the registration desk. So ask for Frederick, and he'll make an appointment with you to see the patient navigators, which are also outside. And we'll also be sending a survey out via email after the summit. So please respond and share your thoughts so that we can make this event even better next year. And also save the date. With the overwhelming response we got to this, we were afraid we weren't going to get 100 patients, and we actually got 200 patients here, and we have hundreds of patients seeing this online streaming. So we're doing it again. So save the date, September 23rd. 2017 here in New York City. So with that, I'm very happy to have you all here, and I hope you get out of this what we expected when we put this all together. So thank you very much.